This question comes from Marcus, who asks, if someone's immune system suddenly vanished, how long would that person last? They would instantly be about a couple of pounds lighter. Unfortunately, the consequences wouldn't stop there. If your immune system disappeared, it's possible you'd feel something. A faint, body-wide lightness, as billions of white blood cells blinked out of your blood, lymph nodes, and marrow all at once, but maybe not. After that, you would probably feel pretty normal, for a while. Nobody has ever lost their entire immune system, so we can't say for sure what the precise sequence of medical consequences would be. But bubble boy disease, immunosuppressant drugs, and radiation poisoning can give us a rough idea. Severe combined immunodeficiency is a group of rare genetic disorders found across the human population, known by the common name bubble boy disease. SCID is a quiet, invisible, ordinary-looking condition. If you're like me, you were told as a kid to wash your hands and cover your mouth when you cough. A working immune system is the reason those small exposures never hurt you. SCID is the reason those instructions matter. If you're born with no immune system, for a little while you'll seem fine. Then, days or weeks later, you'll suffer from relentless infections, fevers that won't clear, and illnesses that keep coming back. Then you might seem to stabilize, by which point ordinary microbes have often already taken irreversible hold. The most famous case was David Vetter, a boy who lived almost his entire life inside a sterile plastic bubble because the everyday germs the rest of us carry without a second thought could have killed him. Isolation kept him alive for years. When he finally received a bone marrow transplant meant to build him an immune system, a hidden virus in the donated tissue slipped through and spread through whatever cells it collected in. Since most of your body is made of cells vulnerable to infection, this is bad for you. Death is generally caused by an infection the body simply cannot contain, since without defenses, even a mild microbe becomes lethal. Sometimes, intensive isolation and a successful marrow transplant can be enough to save a patient, but often not. The frightening thing about having no immune system is the silent phase, the period where you feel completely healthy while bacteria and viruses quietly multiply inside you. Fever, swelling, redness, and pain are things your immune system produces. Without it, an infection can spread with no warning at all. This pattern is typical of immune failure, and we'd likely see something like it in someone who lost their immune system. The picture is even more vividly illustrated by two other examples of immune loss: immunosuppression and radiation. Immunosuppressant drugs, some of the most common and potent medications given to transplant patients, deliberately blunt the immune response so the body won't reject a new organ. The reason these drugs work is that they quiet the very cells that would otherwise attack foreign tissue, but those same cells are the ones that attack invaders. Chemotherapy does something similar as a side effect. It targets rapidly dividing cells and bone marrow, which produces blood including white blood cells, divides constantly. So, chemo hampers the production of immune cells, causing hair loss, vulnerability to infection, and, most dangerously, an immune system too weak to protect you. Gamma radiation also harms you by destroying fast-dividing cells. And because your whole body can be exposed to radiation at once, it's probably the kind of real-life injury which most resembles Marcus's scenario of losing your entire immune system. Radiation poisoning has a walking ghost phase when the body is still working, but the bone marrow has stopped making white blood cells and the immune system is collapsing. In cases of severe radiation poisoning, immune system collapse is the primary cause of death. Without a supply of white blood cells, the body can't fight off infections, and ordinary bacteria, the kind living on your skin and in your gut right now, can get into the body and run wild. In short, losing your immune system would most likely result in no symptoms at all at first, followed by silent spreading infection, sepsis, and death within days from overwhelming systemic infection. On the other hand, there would be at least one silver lining. If you've ever been kept up all night by hay fever, watched your body reject a life-saving transplant, or had your immune system turn around and attack your own joints, skin, or organs, None of that would ever trouble you again. Your body would finally stop fighting itself. Of course, it would also stop fighting everything else. But hey, no more seasonal allergies.